Hello everybody, my name is Alex and this is the 7th episode of our podcast, Reframing Modern Medicine. Our mission is to bring awareness on the evolving treatment choices for the human condition. Today we interview Michael DeSchalit, a certified hypnotist. In this episode, we talk about hypnotherapy and how hypnosis is a complementing modality to medicine. If you would like to enjoy this podcast with video, please check out our page on Spotify and YouTube. Thanks, and we hope you enjoy.
All right. So, good afternoon, sir.
Thank you. Good afternoon to you, Dr. Rivas.
Welcome.
Sounds so formal now, doesn't it?
Sure does. Welcome to the show. Can you share a little bit about yourself and who you are?
Sure. My name is Michael DeSchalit. I'm a clinical hypnotherapist, as well as a stage hypnotist, a magician, and a motivational speaker. So I do a lot of different things, but I know today we're going to talk about hypnosis, hypnotherapy predominantly.
Right. Specifically, yeah. That's great. So can you let us know, I guess, where do you come from, if that's okay? We talk a little bit about where you're from and how you arrived here.
Sure. So my journey to get into hypnosis was sort of an interesting one. I've always been an entertainer, and I started off as a magician, and then I saw an ad in one of the magic magazines, and it said, learn all the secrets of stage hypnotism. You know, it said, magicians, are you tired of carrying those heavy props? And I went, yeah. And because I had illusions that were 350 pounds. So I was tired of doing that. And, you know, you want to help people, you want to travel the world, you want to entertain people, working just out of a backpack. And I'm like, heck yeah, that's what I want to do. So I went sort of a backwards route. First, I became a stage hypnotist. Mm-hmm. And then at my very first show was for a college sorority. And so I hypnotized a bunch of college girls, and it was a blast. It was a great show. And after the show, a couple of young ladies came up to me, and they said, we saw what you made the volunteers do up on stage, and can you make us quit smoking? We want to quit smoking. Mm-hmm. And I'm like, well, I don't really make you do anything. You got to want to do it. But I'm not really capable to do that. I'm a stage hypnotist, not a clinical hypnotist. But I referred him to a friend of mine in town, and he took care of him. And I thought to myself, you know what, I'm missing an opportunity here for, number one, not only to make money, but most importantly, to help somebody, to possibly not just change their life, but perhaps even save their life. So I immediately went back to school and did about 250 hours of training and became certified as a clinical hypnotherapist.
A clinical hypnotherapist is a professional who uses hypnosis as a therapeutic technique to help individuals with psychological or behavioral issues such as anxiety, phobias, smoking cessation, weight management, and pain control. Hypnotherapists induce a relaxed, focused state in the client known as hypnosis to explore and address underlying issues through positive suggestions and guided introspection.
That's awesome.
So that's the short version of the story.
Right. So hypnosis, what exactly is it? How is it defined? How do you define it?
Well, you know, a lot of people think it's voodoo and witchcraft, and that would be really cool one day if it was, if you could just, you know, hypnotize somebody and shoot lightning bolts out of your fingertips and turn your eyes into spirals and make them cluck like chickens and all that other good stuff. That's what the misconception is. But really what it is, it's a natural state of mind that we all go into a couple times every single day. Every single person does this. Mm-hmm. When you're falling asleep, you pass through that, from that waking state to the sleep state, and in between is hypnosis. It's called hypnagogia. And then when you're waking up in the morning, when you're coming out of sleep, there's that in-between land between being fully asleep and fully aware, and that's hypnopompia. And so those are the technical scientific terms, but in essence what hypnosis really is, it's a state of disassociation where your body becomes very relaxed, but your mind becomes very aware. You shut down your critical thinking, your critical factor, your analytical mind, your conscious mind, and then you turn on or pay more attention to your subconscious mind and accept suggestions that are commensurate with goals that you want to achieve in life. And those suggestions then become beliefs. And your belief system is the strongest system you have in your body. So once you change those wishes into wants and wants into beliefs, then you can create change.
And so how long is it just required to have one session, or is this more of you know, a couple months, years to, let's say I wanted to, I don't know, throw out an easy goal, like I want to be a millionaire or something, and you know.
Sure. Well, I can't make you make money, but to answer the question, is it a single session or multiple sessions? You know, you can accomplish a lot of change in one session. We also know, just like most therapeutic practices and modalities, that repetition is really important. So to keep anchoring in those suggestions and keep anchoring that change in. And what I find true with a lot of clients, actually most all of my clients, is that my introductory program is 4 sessions in length. The first session, we really get into it and work on the things that they want to make changes to, why they originally came to see me, or their presenting issue, if you will.
Yeah.
And then the second session, we reinforce those thoughts and those suggestions and reinforce the new belief system that they're creating. And then by session 3 and 4, they come back and they tell me, you know, gosh, it's working great for that. Can we also use it for this too? And they'll come up with something else on their laundry list of things they want to work on. And, you know, focus and concentration, or better eating habits and making better choices, or eliminating a bad habit and reimplanting a better new habit.
Yeah.
And so we'll start working on that as well. And that's the cool thing about hypnosis, is you can just stack as many things on it as possible.
Oh.
Yeah, I like to look at it like this. This is a sort of a poor analogy, but it makes sense when you say it, is that I'm kind of like a good mechanic. If you come in for an oil change, we're going to do a multi-point inspection. We're going to make sure everything else is working great too, because hypnosis, like most outside of the normal practices, outside of medicine and pills, hypnosis is a holistic practice. So we don't just work on one area. Everything relates to every other area in your life too. So we want to work on multifaceted approach every time we come in and see each other, see each other for a session.
I see. Yeah. Well, it's kind of like what we do here, chiropractically speaking.
Absolutely the same thing.
Very
Right.
similar.
Right.
Okay, that's wonderful. So when you say you stack stuff on top, you mean, so is it are you trying to achieve one goal and then in the process of that goal you add another goal, or is it like you've accomplished one and then you move to the next?
You know, it's a little bit of both. It depends client by client. It's different with every single client. Some people think more linear. Some people think, you know, a little bit more abstract. What I do know about hypnosis is this. It doesn't cause anything bad to happen, but it can reveal things. It can expose things.
Yeah.
So a lot of times people will come to me, say, for weight management. They want to change their eating habits. So we start working on those habits. And a lot of times, you know, they think it's just the food that they're eating. And we know it's really not just about the food. It's about why they're eating. And a lot of times that's connected to emotions. And sometimes those emotions come from deep-rooted issues that they had when they were younger.
Yeah.
And we have to go back and address those issues.
Yeah.
So one thing can reveal another thing or another thing or another thing. And even with, you know, something as simple as wanting to have improved confidence. While I'm working with a client for confidence, which is one of my specialties, confidence and self-esteem, they realize that, you know, gosh, I'm feeling more confident now. This is working great. But you know what? I still have a little bit of a fear of public speaking, and I have to do this big presentation coming up here in a month. And so we can work on that fear of public speaking too.
Yeah.
That's related to confidence, but it's not originally what they came in to see me for.
So, yeah, now I've personally had the experience of receiving one therapy session, and it was life-changing, at least for me, because in that session, it's as you described, you know, I sat in a chair, they told me to relax, focus on, you know, just kind of breathing, and they had some, I think they had music, if I forget, her name was Barbara, she's a hypnotherapist, and she lives in PV in Palos Verdes, California, and so she had me in the chair, she relaxed, and then she asked me, and she said, you know, tell me about, you know, what you were seeing, or more like a situation. You're in a room. What do you see? What do you feel when you're having this anxiety or whatever, anxiousness, or these thoughts of you can't achieve or do something or accomplish something? And so I described that, and then she got into like, all right, let me talk to the younger version of you. And it revealed so much, because it really, I was able to go back, and she said, well, what do you see? And then it was so amazing, because like you said, you don't connect the two dots. And she said, this is never quite structured, she says, sometimes, because what's going to come out is going to come out. It's going to be revealed to you and me, and we're both going to discover together what's really going on. And
Right.
it's just
right.
a journey of self-discovery, right?
It really is. It's a journey. It's you know, it ends up being to the destination that you want to achieve, but it's a journey to get there sometimes. And there's a lot of ebbing and flowing, and it's a lot like what you do. And I've been a patient of yours, and I've come in and you know, I told you here's where I have some issues, and then you kind of showed me where it's really not the part that's a pain is, it's caused in another area that is connected to that area.
Right.
And so that makes a whole lot of sense. Everything is connected. Everything is that holistic picture. You can't just go, well, I want to quit smoking, or I want to lose weight, or I want to eliminate stress. Okay, you got to get to the root cause of it. What is causing those things to happen? And so it's that journey of self-exploration. And when I work with my clients, that's a big thing that we do is we spend a lot of time figuring out, first of all, what they really want. Because a lot of times they think they want something, but they really want something else. And that all comes out in that self-exploration.
Now, what is it more? Is it do you feel it's more of ego in those situations?
Ego is a person's sense of self-esteem or self-importance.
When you say it's not really what they're trying to achieve, or is there an example maybe that you can provide us with?
Yeah, sometimes it's about ego, and I use a process that I created about 12 years ago. It's a protocol that I use with all of my clients, and I actually train other hypnotists in this protocol now. And the protocol really helps them to discover uncover, discover, and reinforce their expectations of what they want. See, there's a difference between what people wish for and what they want.
Right.
And so a lot of times, wishes are superficial, wants are very deep-rooted. And so an example of that might be that, again, going to a weight loss situation, people think it's about the food that they eat, but they realize it's a little bit deeper of an issue. It's more about maybe their mental set about why they eat food. And most everybody eats emotionally. Whether they believe it or not, they do. Yeah. I had a client once, and she doesn't mind me sharing the story. Of course, I won't reveal her identity, but she used to eat a lot, and she was overweight. She needed to release some of that weight and have better eating habits. She came to me because she thought it was just because she ate too much. And then over time, we discovered that what it was when she was growing up, her family didn't have much money, but they had a lot of food. And so as a reward for doing things, she would get meals. And she would come home from school, and after, her mom would ask her, did you have a good day at school? And she'd show her her homework, and she got an A, and mom said, great, let's have a meal. And she would eat like the first dinner, she called it. And then her dad would come home from work a few hours later, and they would have dinner again. And that became a pattern in her life. Every time she did something great, and she did amazing things in her life. Yeah. Every time she did something great, she would reward herself with food. It's an emotional reward. And so she was eating 2 dinners a day. And consequently, she also kept that same pattern with her own son. And her son became overweight. Because the same pattern happened. He'd come home from school, she would feed him a meal. Then dad would come home from work, they would eat a second dinner.
Ouch. Yeah.
So instead of 3 meals a day, it was 4 meals a day, and obviously calories in sometimes stay.
Yeah.
And they don't always go out.
It's true. Yeah. So it's kind of like a Pavlov, right? Is that the little bell, right? Ding.
Yep.
Pavlov's, I forget what it was.
Positive reinforcement.
Yeah. It's was it a dog, right? They started that? They just ring a bell, and then the dog knew, hey.
The dog would salivate,
Yep. It's time to go.
He knew he was going to get a treat.
Pavlov's dog is an experiment conducted by Ivan Pavlov in 1897, where a dog was fed every time a bell rang so the dog would get used to hearing the bell and then getting food. Eventually, the dog began salivating whenever it heard just the bell. Pavlov called this psychic secretion.
All right. And so what other, moving into like myths or misconceptions or misunderstandings of hypnosis, do you encounter on a daily, or have you encountered in general?
Yeah, there's some basic ones that people, have about hypnosis. They think it is voodoo and witchcraft. They think I'm going to control their minds, and I always tell them jokingly, it's like, if I can control your mind, I wouldn't be here right now. I'd be ruling the free world, from a beach in Tahiti, right? I would just be controlling everybody's mind. And then I have a little joke that I say in my hypnosis show that, honestly, I can't even get my teenage daughter to clean her room on a regular basis. So if I could do that, I would just stay at home, right? So they think that I'm going to control their mind, and it's actually just the opposite. When you're in a hypnotic state, you're in touch with the most powerful part of your mind, your subconscious mind. So you're more in control in hypnosis of your mind than when you're not in hypnosis. Because your subconscious mind is more powerful than your conscious mind. Subconscious mind is your literal mind, accepts everything as received. That's where your beliefs are stored, your morals, your values, your ethics. So when we change the beliefs, we're changing them subconsciously. Because then once you get a belief cemented in, it's hard to sway you from your belief. Just like people have political beliefs, religious beliefs, familial custom beliefs, and they don't change those and are not easily swayed. Your conscious mind, on the other hand, is analytical. It analyzes everything. Those are the voices you hear in your head, not the ones you need medication for, but the other voices. Those are different voices. You might want to see a psychologist for that one. But those are the angel and devil you have on your shoulder. You see it in the movies depicted that way.
Yeah.
And so that's the analytical part of your mind that argues with itself. And so that's why it's hard to reason with yourself.
Yeah.
So now, one of the biggest misconceptions of hypnosis is, again, that I'm going to control your mind. I'm not. There's other ones that people have, some fears that people have. I'm going to make them do something they don't want to do. I'm going to make them cluck like a chicken, bark like a dog, or sing like Elvis. I don't even do that in my stage show. It's just too clichéic, right? And I can't make anybody do anything. Like those two college girls said, I saw what you made the volunteers do.
Right.
Well, I didn't make anybody do anything. I can't control your mind. I only suggest it. And if you are willing to do that, then you will. And if you're willing to make a change in your life and want to create a new belief system that's commensurate with your goals while you're seeing me, then you're going to do it. Right. I can't make anybody quit smoking if they don't want to.
Right.
Some other small misconceptions are that you're going to release some deep, dark secret when you're in hypnosis. You're going to reveal all the dirty stuff. And that's not true. If it was, I would have written books by now about it. I'm kidding. I wouldn't do that. That's all confidential stuff. But you don't say anything you don't want to say. You don't do anything you don't want to do. And lastly, people worry about being stuck in hypnosis. Right? They worry about not coming out. And I always tell them, if you get stuck in hypnosis, well, it sucks to be you. The session's over in 15 minutes. And so if you stay in that chair, it's another $200 an hour. So they usually open their eyes at that point. So see, nobody gets stuck in hypnosis. I'm kidding. I'm kidding, of course. Yeah, nobody gets stuck in hypnosis. It's because you're in complete control. That's the power that you have and that you give yourself in hypnosis. There's a lot of those funny misconceptions because Hollywood and TV and books and they've given hypnosis sort of a bad name, and they make it look like the hypnotist is really controlling people's minds. Right. But in a stage show, of course, we'd like it to look that way for entertainment purposes. But in reality, though, we're not controlling anybody to do anything, to say anything. And the last thing we want you to do is be stuck in hypnosis, because then we got to carry you around forever.
Yeah, right.
And we don't want that. We want you to go home eventually.
I told you I was on that show, or sorry, the one is it at Harrah's?
Oh, right. Right. Hypprov, I think it's called.
Yeah,
Hypprov. Yeah.
I actually went on stage for that, and I told you, it was fun. It was such a blast, and you told me it feels like you're like a buzz or some sort of altered state. The whole time I felt like I was just playing and having a good time, but I definitely felt this relaxation, I guess you would call it. This sense of just my body felt at ease.
Yeah, here's a minute ago you asked me how would I define hypnosis, and I said a state of disassociation. That's the clinical definition. Right. Where your subconscious mind disassociates from your conscious mind. You stop analyzing, you start accepting literally. Yeah. So here is the Michael DeSchalit definition of hypnosis. I like to call being in hypnosis as being in the land of I don't care. You know what's going on around you, but you just don't care. It's that 2-beer buzz.
Yeah.
It's that lack of inhibition where you feel like you're okay doing it. Now, here's the caveat, though, and there is a safety caveat with hypnosis.
Right.
If the hypnotist, Assad, if he would have said to you in that show, if he would have said, now I want you to take off all your clothes and run around naked and go rob a bank, you wouldn't do it. Well, at least the bank part. I don't know what you do about the clothes part. It is Vegas after all, right? Yeah. But you wouldn't do it because you know that would violate your morals, values, ethics, or beliefs.
Right.
So, but if he wanted you to sing like Elvis or bark like a dog or cluck like a chicken or go out and kiss every woman with glasses on in the audience, you would do it because that wouldn't violate those morals, values, ethics, or beliefs. Everybody has a line in the sand, and hypnosis can't make you cross that line.
Right. So that means that the old guys at the gym that are walking around naked and don't care, are they under that?
They're not under hypnosis, but they might be under the influence of Viagra. So maybe that's it. I don't know. I don't know.
I didn't look in that direction, but
yeah. Now, if you were looking, then we have to have a different conversation at another time. But so I don't know what that is.
Because I feel as we get older, that level of how would you put it? Comfort level kind of changes over time. Like you said, we tend to care less, I feel, as we grow older. I mean, maybe like Alex, he's younger, he's 18 versus myself, I'm 42. So it's like I care less about the things that he may worry about, right?
Right.
So that varies. So those layers are kind of peeled away, I'd say, maybe as we get older. Would that be an accurate description, kind of more or less?
It is. And in a stage hypnosis show, there's audience that are somewhat easier to hypnotize than others for that very reason.
Yeah.
For example, high school kids and college kids are very easy to hypnotize because they'll try anything. Okay. Yeah. When you get into the middle age category, you're a little bit more reserved because you're trying to look professional and represent, and especially at a corporate event, like if I'm doing a corporate event and doing a hypnosis show for their holiday party, they might be a little bit more reserved because they have to work with each other. They're still hypnotizable. Everybody's hypnotizable.
Right.
Okay. We'll talk about that in a minute, but everybody's hypnotizable. But then as you get older, senior citizens are very easy to hypnotize too because, like you said, they just don't care.
Yeah.
Matter of fact, I'm getting of that age right now. I'm 58, so in a couple more years, I'm crossing that. I don't want to say the Rainbow Bridge. That sounds bad. I'm crossing that bridge though, where I don't care. I care less and less every single day. So, matter of fact, I'm leaving now. That's it.
No,
I'm
you look.
No, okay, all right, okay. I'll stay.
You look great, by the way. You look great.
I'll care a little bit longer, and I'll stay a little bit.
You look great, though.
Yeah, but. Going back to that, yes, you feel less inhibitions when you're a little bit older or when you're a little bit younger. In the middle, it's a little bit, less. You feel more inhibitions because you want to look good. You have an image to maintain and all that. But since I did mention about the different types of people that can and cannot be hypnotized, here's the reality. Everybody goes into hypnosis naturally on their own. But as far as intentional hypnosis, whether it be clinical or in a stage show, everybody can be hypnotized, okay? Except for there's 3 categories. If you're under the influence of drugs or alcohol at the time of inducing hypnosis, trying to go into hypnosis, typically you won't go into hypnosis because you can't focus long enough. It takes a very, very intent thought process to go into hypnosis. And then, they used to think a long time ago that it was only the idiots can be hypnotized, only dumb people, okay? Now, or gullible people. And I don't know if you know this or not, but gullible is a word, it's not even in the dictionary.
It's not? Just kidding.
Gullible is in the dictionary, so you fell for that. It was good for you. And so, if you're under the influence of drugs and alcohol, you can't concentrate and focus long enough.
Yeah.
If you've had a severe brain injury or you have an IQ below 70, same issues. You can't concentrate and focus long enough to go into hypnosis. Now, even people with ADD, ADHD can go into hypnosis. There's different techniques for that. But if you have an IQ below 70 or if you had severe brain injury, brain trauma, it's sometimes difficult because you can't focus long enough to go into hypnosis. And the third type of person who can't go into hypnosis is one that says, I bet you can't hypnotize me. And they resist it. Again, it's not brainwashing. It's not mind control. It's not voodoo. It's not witchcraft. I can't make you go into hypnosis.
Right.
But then again, if you come to see a hypnotherapist, you're not going to resist because you're there for help.
Right.
And if you go into and volunteer into a stage hypnosis show like you did, you went up on stage because you knew there was a likelihood you were going to be hypnotized. Otherwise, you wouldn't have gone up there.
Of course.
He would have seen right through that if you were just going up there to test him, and he would have sent you back.
Yeah. Yeah, they did. He kicked out. They booted out, like, I don't know, there was like 18 people.
Probably,
yeah,
a dozen or so people, yeah.
Yeah, and then they just stayed with like 4 or 5.
Yeah, sure.
It was great. I had a blast. I was like, man, this is my dream come true. You see these people on TV, and now you get to do it with them.
Now you get to do it, right?
Yeah,
right.
It was such a good time.
As a matter of fact, I put you in hypnosis before we started, and so you're asking great questions, though. And sleep. It doesn't work that way.
So can you share with us one of your like biggest, most successful experiences you had, or with your patients or one of your clients?
Yeah, and we call them clients in hypnosis because hypnotists aren't licensed healthcare providers. We don't have to abide by the same HIPAA compliancy, but a lot of us do because we want to keep the integrity of our clients and confidentiality of our clients. But we call them clients. Some of the biggest things are really just on a career level. In 2013, I received the Hypnotism Achievement Award by the National Guild of Hypnotists, and then in 2016, I was awarded a Hypnotist of the Year, which puts me in the top 100 hypnotists in the world.
That's awesome.
So it's a nice distinguishing award to have. But what really matters is how I help the clients, and a couple of different things that I've helped people with is, I remember helping a lady who had smoked for 40 years. A 2-pack-a-day smoker, and she wanted to quit, but she also needed to quit for health reasons.
Yeah,
and she didn't believe that she could do it, and we changed her belief system. She wanted to do it, but she didn't believe she could. So there's that dichotomy there, right?
Yes.
That limiting belief. I also work with some professional athletes. I work with some high peak performers in their field, and so just helping people break through those limiting beliefs, those glass ceilings that they otherwise would have been stuck at a certain level. But I would probably say, a few times working with young people where they have made profound changes, where you find out later that, they were on the brink of doing something horrible. And we know what that is.
Yeah.
And they found it in themselves a reason to not do that and a reason to turn it around, and instead of being down in the dumps, be on top of the mountain.
Wow, that's amazing.
So that's without getting too much specifics, that's really basically what happens, and it happens a lot. Most of my clients that come and see me, they're ordinary, everyday people that want to make some ordinary, everyday changes in their life.
Yeah.
They want to just be a little bit better. And then again, the peak performers want to be just a little bit better too. Everybody gets into a slump now and then, and they need to be sort of booted out of that rut.
Right, that makes sense. Oh, man, that sounds very powerful, very life-changing in many ways. So do you ever work on your own family? I'm assuming not, because you talked about your daughter and stuff like that.
My family doesn't even like to talk to me when I'm in hypnosis mode. No, they, I've hypnotized both of my daughters for some dental pain. They had some procedures done, and they were having some pain and discomfort. I hypnotized them. I hypnotized my wife. Typically, though, as a general rule, we're not going to get into some deep therapy with our families. We're a little too close to that action, if you will.
Yeah.
So we prefer to refer them out to other hypnotists that they trust and that they're comfortable with. So the answer is yes, but only for simple stuff, because if it was anything more than that, I would want to be removed from that situation for just professional reasons.
Oh, that's interesting. That's cool.
Yeah.
I didn't think about that.
Sure.
It makes sense. But with your wife, I'm sure she's comfortable for the most part with you. So
Right.
Yeah. All right.
Well, for the most part, yeah. You've met my wife,
Yeah.
So
She's cool. She's cool. She seems cool. And she. Oh yeah. So going back, you perform magic as well. If that's okay, if we talk a little
sure.
bit about that,
Yeah.
if that's all right. And where did that start? When did you feel the the urge to pick that up and get the itch?
It started when I think I was like 6 or 7 years old. I used to watch magicians on TV, and I used to watch David Copperfield. And,
Yeah, right.
And he would do things, and I would just get so irritated on how he would do them. I tried to figure it out, and I couldn't figure it out, you know. And,
Right.
and so I figured, you know, if I learn how to do magic, then I'll just learn all the secrets, right?
Yeah.
And so that's really why I started wanting to learn magic. I just want to know how this stuff worked. So I started when I was about 7, and then, you know, you can only go so far as a kid with a magic set.
Right.
And so I put that away and got into another performing art. I became a musician for a while and did that all through college, and it paid for college. And then when I got out, there wasn't a big demand for solo trumpet players. So I decided to put that away and got back into magic, and started with one simple trick. That trick that I gave you to do that.
Oh, yeah.
The magic wand with the 6 different colored stones, right?
Yeah.
It was the very first magic trick I bought professionally as an adult. And I learned how to do that, and then I started taking lessons, and then it became sort of, we'll say, an obsession to learn more and more, and then truly it became an addiction, if you ask my wife, and and then it became just, you know, an endless source to spend money on stuff, and so then I started doing it professionally and doing shows and performing the big illusions, and then performing comedy magic and traveling all over the world doing magic, really, magic and hypnosis shows.
So, with going back to hypnosis real quickly, where would you say is it the most popular or common, or has anyone implemented it into maybe the medical field or any type of treatment within the medical field, maybe in another country or other places like that?
You know, we use hypnosis for medical stuff all the time, here in the United States and in, you know, around the world, really.
Yeah.
There's a fine line. We have to understand, as hypnotists, we have a scope of practice that we have to operate in.
Yeah.
So we can never purport to cure anything. We can't say that word. That's a medical term. We can't say, we don't treat our clients. We work with our clients. We don't call them patients. We call them clients.
Right.
We don't prescribe things. We can suggest and recommend things. We never recommend or suggest anything when it comes to medication either.
Yes.
A lot of times I'll have a client that's on medication for different psychological reasons, and I always tell them, make sure you check with your psychologist or, you know, doctor before you get off that medication. I'm here to work with you on focus and concentration and whatever we're working on.
Yeah.
That's that. This is this. And so we are there to complement medicine. We're there as an adjunct complement to it. We're not there as a substitution for it. We have certain strict protocol that we have to follow too by our governing organizations, the National Guild of Hypnotists, the International Council of Board Certified Hypnotherapists. We have to follow their rules and standards as well, which says, for example, like if somebody comes in to see me and they have a pain in their knee, and they're an avid golfer and they hate that pain, they want to get rid of it. Well, I have to ask them, because it's pain related. That's a medical concern. I have to ask them if they've been checked out by a doctor. And they say, yeah, and the doctor said, you know, it's nothing. It's just they need to manage the pain. So I get a note, I get a release from the doctor saying that it's okay for me to work with this client on managing the pain, not treating the illness. Okay? Because the last thing I want to do is mask something by helping them control that pain level and bring it down from, say, like a 70 to a 30.
Yeah.
I want to bring it down to a manageable level.
Yeah.
Or even lower than that. But I don't want to mask something by doing that. Like, for example, if they have a tumor in their knee, and then we teach them how to alleviate that pain, and we hide that tumor. Pain is an important process in the body. It lets us know that it needs attention.
Yeah.
So we have to make sure that we're operating within the scope of our practice. But we do use hypnosis as a complement to many medical practices, things for pain management, stress control, smoking cessation, weight management. Those are all medically related things as well. Not to mention, there's been a lot of work with hypnosis in cancer patients.
Really?
So when you're going through chemotherapy, sometimes it could be painful or could affect you mentally too. You get bummed out, and obviously when you have cancer, that's nothing you want to jump for joy about.
Yeah.
So you do get psychologically bummed out. So we'll help people with their attitude process, changing their attitude, become more of a fighter than a fleer. And so it's a good complement to many medical practices out there.
It's amazing.
Painless dentistry, painless childbirth. Yeah, so you can use it to control the pain during those procedures.
My goodness.
As a matter of fact, when my wife had our 2 daughters, we used hypnosis, and I didn't feel a thing. It was great. So.
I'm glad you didn't.
My wife hates that joke, by the way.
I'm so worried about.
You can edit that part out.
That's cool. And so if one was looking, so you talked about weight loss, smoking, confidence. What other things that is it also helpful with? I mean, you talked about a lot of goals. Are there other things that maybe people would not suspect that it would be good? I mean, cancer, that's pain issues, that's very amazing.
Sure.
Has there been things you've discovered that it's been helpful with as well that's not common?
Absolutely. My specialty is I have a great weight loss program. It's called the Hypnotic Gastric Band System. So it helps the client to believe in their own imagination and in their own subconscious mind to believe that they have a lap band put in. Now, lap band is a branded appliance name for something you put on the stomach. So we call it the Hypnotic Gastric Band System. So it makes them think that they have a band around their stomach, so their stomach is smaller, they eat less. I also work with some smokers as well too. I have a great smoking program. My real specialty though is working with people with self-esteem issues, confidence issues, achieving goals, getting to that next level in life. Getting past those limiting beliefs and those barriers that are stopping them from success. That's my real passion in life, and that's my real forte. That's where I focus on most of my clients, is that. But I will work with weight management. I will work with smoking, because those are also tied into confidence and self-esteem and all of those other things as well too.
So I would assume that going to see you or setting up a session with you would be a step in the right direction for like self-love, which is, I'm sure, part of that self-esteem.
Absolutely.
And
absolutely. Healing over a traumatic breakup, a relationship dissolution, or, just anything that a loss of a loved one. That's a good way to help clear those thoughts, to manage them. We don't help you to forget. We help you to manage.
Yeah. So what about in the case of, I have a patient in particular that lost her son. He passed away, and so she's still going through the grieving process. Do you guys help with that as well?
Absolutely. Yeah. Because again, that's just, we don't want to eliminate, we don't want to make them forget. We want them to manage it appropriately, because grieving is necessary. It's a necessary process, but it doesn't have to be painful the whole way. So there's ways of managing that, just like managing stress. We're never going to eliminate stress. If you have to have some stress, stress keeps you alive. It keeps you from making a horrible mistake, like, hey, let's jump out of this plane. Oh, I forgot I need a parachute. And that it helps you with staying safe and staying alive. It's part of the natural instinct that we have. But we don't need to have more than we need to have. We need to manage it and learn how to control that, so we can keep things in check, because we also know stress is important for survival. We also know that stress kills. So we have to find that balance somewhere in the middle. And or hopefully towards the lower end of the spectrum.
Yeah. Well, I'm sure you deal with athletes, as you mentioned, and their mentality has always been their body is their driving force and motivating factor for all their achievements and what they do in life. And when they lose that ability, like maybe some paralysis or something, I'm sure that must be difficult for them, and you help them out with that. Or I don't know if you've ever
absolutely. Yeah, because that's another sort of grieving process too, ending a career. Something that they're passionate about, something that they do, even just a regular professional career. At some point in your life, you're going to retire. But right now, this is who you are. It defines who you are. And think, if you had to retire because you couldn't do physically what you do now, that's going to be a big shock. It's going to be a big shock to your psyche, your ego. It's going to be a big shock. And some people, they're ready to retire, and some people aren't ready to retire. And if an athlete gets taken out of the game a little bit sooner than they expect, certainly that's a process. And it's a grieving process. So I know I went through that myself when the pandemic hit. I had a show downtown called Hypnomania. And I closed down the show. Well, the pandemic closed down the show for me. I walked off stage on March 15th, Sunday night at roughly about 7 o'clock when the show ended, and the next morning the entire city was locked down and all casinos were closed and everything. it was my identity was taken away. And that's an incredible grieving process to have to go through. And if it wasn't for hypnosis and help from other friends that are hypnotists, because I know a lot of these guys, I've trained 300 of them worldwide in 13 countries, so I know who to call when I need some help.
Right.
And so we ended up working on each other, a lot of us did, because even the hypnotherapist who had offices couldn't see their clients. So they lost not only their incomes, but their identity. And so that's traumatic. And you have to be able to deal with that appropriately and effectively.
So how would you manage, or how is it managed in the case of like hypnotherapists, I mean, other healthcare providers, etc., or even mothers, whoever, that have this desire to feel wanted or needed, you know what I mean?
Sure.
And then now, because I think that's, in my mind, that's what you're kind of describing. I mean, and I don't know how healthy it is to want to have that feeling of like, yeah, I feel like I'm wanted and needed within my community or whatever.
Sure. Well, and a lot of times, you know, you get in the groove. You do what you do. You see patient after patient after patient, and you're good at what you do, and you know you're helping people, but after a while you sort of desensitize to that. And you lose track of all the people you're actually helping, and it becomes a four-letter word for you, a J-O-B. That's only 3 letters, but go with it. So it becomes a job, not a passion. So we got to get you realigned. Why are you doing what you do? Answer these questions internally. What is it that you wake up every morning about and feel excited about? Why do you go to work? It's not just a job for you. It's a passion. It's a calling. It's a life purpose.
Yeah.
And so getting your thoughts realigned to that instead of just thinking, you know, I'm not helping anybody. I'm not appreciated. Because, you know, I'm sure everybody appreciates you that come in here, but some appreciate you more than others.
Yeah.
You know, or they show it anyways.
Yeah.
You know, everybody pays when they leave. That's appreciation.
Absolutely.
That's respect. But, you know, some people will give you a hug after a treatment.
Yeah.
And it makes you feel good. I've experienced it many times where I've been walking in a grocery store and somebody comes up to me and goes, "You were my hypnotherapist. You helped me quit smoking. I've been 20 years without cigarette now, and this is great.
Amazing.
And I breathe deep now. I can taste my food now. I don't stink like an ashtray. I love it." And you know, that's the biggest reward out of anything, just knowing that you have, in that case, probably saved that person's life. You do it too. You do it in the office every single day. There are people that you don't even know you saved their life. You've made them feel better, because if they had to live in the pain that they were living in before, eventually it would destroy them, not just physically, but emotionally.
Yeah.
So, but as far as feeling that you're appreciated and loved, absolutely. Self-love is a big thing, what we do. You have to feel confident in yourself before you can help others. So I'll teach you how to be selfish a little bit.
Yeah.
With selfless intentions.
Yeah, I think that's something I struggle with sometimes.
Right?
It's like,
So
I don't need that nice new big shiny thing over there. Or yeah, I don't need to take a vacation. I'm okay. I need to work a little more.
You know, you got to take care of yourself too. And you know, it's the old adage, when you get on a plane, they tell you if the cabin pressure changes, the oxygen masks are going to deploy, and they tell you to put them on yourself first.
Right, absolutely.
And you're thinking, that's really selfish. I've got kids with me. What do I do? Well, you put them on yourself first so you're not a liability. So then you can help others.
Absolutely.
So you have to be selfish with selfless intentions.
Yes.
The more selfish you are when you're working on you, the more selfless you can be when you're working with your clients. The better the chiropractor you will be.
Absolutely. Awesome. That's a great message. Now, this is Reframing Modern Medicine with Alex and Dr. Rivas.
And Michael DeSchalit, hypnotherapist.
Thank you for listening, and we thank Michael DeSchalit for coming onto the podcast. To learn more about Michael DeSchalit, please visit virtualhypnosisonline.com. If you would like to check out other episodes of our podcast, please visit our page on Spotify, YouTube, Apple Podcasts, Amazon Music, and iHeartRadio. We have another podcast with Michael DeSchalit coming out soon, so if you would like to hear more of him, please stay tuned. This is Alex signing off for Dr. Rivas. Thanks for listening and or watching the 7th episode of Reframing Modern Medicine, and we hope to see you again soon.